Hey guys, welcome back to my YouTube video channel. Today I'm so excited to have Dr. Jim Ratcliff. He is a founder of the company Closys, which is the brand name of Ralph Farr Pharmaceutical Incorporation. I am excited to have him on the my channel, and I'm honored to bring him in because he have been my co-sponsor for my dental charity event in the past several years. Every time I have the charity dental event, and Jim is the step up and he say, "All right, how much do you need?" And he just gave me so much stuff that I feel overwhelmingly grateful and appreciate his kindness and compassion to the community that I've been helping involve with charity event in the past 2018 19 and double back and forth. Unfortunately, during the pandemic, we could not do much. But this year, we're coming back, and I'm hoping that Jim gonna also explore the opportunity to work with us too. But without further introduce, Jim, founder of and the chairman of Radford Pharmaceutical. Please, the floor is on you.
Well, I was delighted to get your invitation, Doctor, to join you on this podcast. And let me say that I just am an admirer of your work in terms of the clinics in the Bay Area that you work with. And our company is devoted to helping people get well and stay well. So anything that we can do that fits into your standard of care, we're certainly want to be supportive of it. So just happy to be here. That's great.
And Jim, would you start sharing the journey, how your company started? I know that your dad was the original founder. He were Dr. Ratcliff was the division chair of UCSF way years ago, and he is, he got a great legacy that left behind for his family and the school. And please just, for those of us that don't know your dad, can you please give us some information about your dad, what he worked at UCSF and his work and everything?
Well, thanks for asking that story because he's the hero behind our company. And my dad was number 34 licensed periodontist in the United States.
Oh, wow.
Yeah.
That's incredible.
He went to dental school at Indiana University and served in the Pacific in World War II as a dentist on aircraft carriers, and came back and practiced in Southern California at in San Bernardino, and that's when he became interested in gum disease and began his work towards the specialty board. So before going to UCSF, which you rightly mentioned as his pride and joy in terms of establishing the division of periodontology and stomatology at the dental school at UCSF. He taught for a while at Loma Linda, and then he taught for a while at the University of Southern California. And he was a clinical professor at that time and had his practice in San Bernardino. Then I guess when I was in junior high school, so just yesterday, of course, we moved to the Bay Area, the family did, and he practiced at UCSF and was there when the Western Society of Periodontology and American Academy came together. He was involved in worked to bring those two groups together. And he, at age 55, he had heart disease. He had angina. And he decided that part of the problem was work-related stress. So he retired and decided he would go back and practice periodontology. So he was a periodontist in San Diego and then moved to Scottsdale. One problem that he faced was he could never get the research out of his blood. And so he was keenly aware that gum disease and the work of the periodontist oftentimes is both expensive and painful. And that's really not a positive model for business, something that's costly and painful. So he was always looking for a way to minimize the need for periodontal surgery. And that's how the product got its start, was through that research. And our first generation of what's now Closys were directly related to his work. Today, our formulas, we refer to them, are third, fourth, and fifth generation formulas to try to accomplish new things and new indications. So I can get into that. But he led the company for the first decade of its existence. He got it started with some other leading dental professionals, and many of our shareholders are dentists or dental entities, dental office profit sharing plans and retirement plans and that sort of thing. So we're pretty firmly rooted in dentistry, but that's the short version of the long journey to how we got here.
Yes, thank you so much. And I also noted that the board of your company, Dr. Sunil Kapila, no, I'm sorry, Dr. Ivani Kapila also were associated with UCSF as well. So that was wonderful. You know, I spoke to one of my friend who is still teaching at UCSF, and you know, they see he's the Dr. Kapila is well known at UCSF as well as the division chair. So it's wonderful connection that you know, your company have at the board of advisor and things like that.
So so on our board, in addition to Dr. Kapila, who's there's an interesting generational story there, but is Dr. Ted Nakata. Dr. Nakata has just recently retired from practice in Fresno, California, and then Dr. Gary Armitage. Well, Dr. Armitage was chair of periodontology and was a student of my father's at UCSF.
Wow.
And then Dr. Kapila, Yvonne, was a student of Dr. Armitage's. So that's why I say three generations of UCSF researchers have participated in this company. And Dr. Nakata, Ted, was also a classmate of Gary Armitage when he went through UCSF. So a lot of UCSF in this. So it's really great. You've got the Golden Gate behind you in the video.
Also, for those of you guys, dentists or hygienists or dental student who haven't had a chance to use the product, Closys is the mouthwash, oral hygiene mouthwash solution. And it's not just that, but they also developed the toothpaste and tooth sensitivity and other product as well. But what my experience with this product is I use it personally before I I recommend to my patient is that this product is incompatible with the other product that you see on the market, where you try it in your mouth, it burns your mouth and it tastes nasty. Not this product, okay? This product is just completely different. So you guys have, if you haven't used it, please check out Closys and try it. And this podcast is basically we want to uh, introduce for again to those who haven't had a chance to use it, this product, and help you guys out know more about who behind this product, and why they become a very popular product right now in the market. Right now, Jim, if you can share with the audience that your company now is able to use the put it on the market, multiple country out there. What are the country on the world in the world that right now you have the market share with right now?
Sure. The We have three toothpaste, one with fluoride, which outperforms all other fluoride toothpaste in terms of remineralization and halting demineralization and strengthening enamel. We have a toothpaste that is fluoride free, which is our original toothpaste, and it contains the same core ingredient that our other toothpaste contain, the sort of fluoride and fluoride free. And excuse me. Then most recently, we developed a formula that's designed for adults 55 and older, Closys Silver, and that's intended to tackle the major problems that people face as they age, adult root caries, and a periodontal disease, dry mouth, because as we age, our nasal passages atrophy, and so we're mouth breathers, so we tend to have more problems with dry mouth and xerostomia. So we have three toothpastes. We have three oral rinses. The original unflavored that you mentioned. A sister of that is the Closys Sensitive, which has a mild permanent mint flavor. The only difference between those two is one is unflavored, or actually has a little dropper so you can add flavor if you want it. But flavor doesn't really determine whether the product works or not. It's just your own personal taste. And then the third rinse is a rinse, Closys Silver oral rinse, and that again is designed for adults 55 and older and the problems I mentioned before. Lastly, we have a little oral spray, little mouth spray, and it's been shown to have the same strength and efficacy as our toothpaste and rinse, and contains the same key ingredient. A study in Hong Kong University Dental School with senior population showed significant improvement in the classic indicators of gum disease. So reduction in bleeding on probing, improvement in clinical attachment, improvement in gingival health. And so we continue to try to do research to both improve the formulas as well as meet the specific needs. So as we go forward, as we look at what we offer, we'll be developing additional variations of our product that meet or are attuned to specific oral conditions. Because we want, first and foremost, to have the people who use our product experience better health, both oral health and systemic health. You might ask where we where we sell our products. Of course, we're distributed across the United States and Canada through the major dental supply companies for dental professionals. So Henry Schein and William Patterson and Burkhart, Benco, all 40 of them, Pearson, Sinclair in Canada. And then we're also distributed in retail. And we made that decision because we discovered that while a dentist may recommend to their patients the use of our product between their visits, the patient doesn't always call you up on Saturday night and say, "Hey doc, I'm out of toothpaste. Can you get me some more?" So it's available in the major pharmacies, Walgreens and CVS, and major mass retailers like Walmart, and Amazon. Just simply because we want people not to have to go out of their way in order to try to find our product, which is a major challenge for a small company dominated by large companies. But anyway, so we're in Australia, we're in China. We are distributed under a different label, under a private label in Europe, and yet another private label in India. So we distribute through partners in those two areas of the world as well.
Wow. Jim, I may ask you, what are the progress that you make so far for your company to put this product into dental school, and you have any update for that?
Well, for the last 7 years out of 27 years, we're happy to say that we've been profitable on the top line and on the bottom line. What we try to do in our business is to take the resources we have and devote them to continued research and to continued efforts to inform the public. And we do that working with dental professionals like yourself. Mm-hmm. And we do that working with dental schools and dental hygiene schools. So you'll find our products, not unsurprisingly, at UCSF and the ortho and in the perio clinic.
Wonderful.
Yeah. And you'll find our products are used by hygiene students in places like Contra Costa College or Phoenix College or Niagara College in Canada, Ontario. Uh-huh. So we're really pleased to, during the pandemic, Doctor, I think the figure is that 20% of dental care professionals retired or left the field. Right. And now we're coming back and we need those professionals. So we want to partner with educational programs in order to help new dental professionals and dental hygiene professionals and auxiliaries come on and help grow back the profession from 2 years ago when most dentists were, as you personally know, shut down for fear of the pandemic. People don't think of dental professionals as necessarily as brave individuals, but they are. If you think about the pandemic and working within a foot or so of a patient's mouth, and of course, unlike many professions, you can't work on the patient with the patient wearing a mask. Right. So we've been very, very interested and concerned in making sure that uh, that the dental profession thrives and is a safe place to work and live. And we've been trying to contribute to that as well.
Jim, real quick, for those of people that haven't tried your product, uh, what are the key distinguished factor that you are proud to recommend people who test out your product? I know I use it, but from your point of view, what are the things that is so different with your mouth product compared to mouthwash product compared to other like Listerine and other company out there?
Well, let me share with you what we use as sort of design characteristics.
Thank you.
So the first thing is that for a person to take care of their mouth every day, twice daily, the product has to be friendly to the mouth. Otherwise, you can say, try this stuff, but people won't use it because it's unpleasant to use.
Right.
So it has to have a pH level that is attuned to a healthy mouth. So somewhere between 6.5 and 7.2, which our products are. The second is that it can't sting, stain, burn, taste nasty. Some products stain teeth, ours doesn't. So those things, those are sort of basics you have to get out of the way in order to get patient compliance, get people to use oral care regularly. Then if you look at it from a use standpoint, there's some design characteristics that we look at. When you take and you put something in your mouth, whether it's toothpaste or oral rinse, it needs to go to work within 30 to 60 seconds. So I could have a terrific oral rinse, but if it didn't start doing its thing within a minute or two, it's useless because nobody's going to brush their teeth for 5 minutes. Nobody's going to wash their mouth out for 5 minutes. So you want something that goes to work immediately. And our products are activated by saliva, acids in the mouth, sulfur compounds, a variety of activators that release its active core ingredient. And so that design characteristic is important. There's a flip side to that. You can have something that is so unstable that you can't put it in a bottle or a tube and transport it to the dentist's office or transport it to the pharmacy because it's lost its efficacy in transport. Mm-hmm. So in oral care, we look at a minimum of 24 months that something must stay in a tube or in a bottle and still be efficacious. Ours are 36 months.
Wow.
Yeah, we have people call up who say, I see this label doesn't look like the label, you changed artwork or something. Is it still good? And by and large it is. And wow. If it isn't, if it's out of date, we'll send them some fresh product.
That's incredible. Those are the key difference between the typical product that we use and the school still recommend. It's just awful that it tastes, it burns your tongue. You try one, you don't want to try it again.
Yeah.
And we still recommend people to, Listerine. Oh my goodness. So.
Well, this is the way that our products work, because they have a common ingredient. What that common ingredient does is it interacts with molecules in the saliva and releases the chlorine dioxide. which is able to break down biofilms, both dental plaque and biofilms that are on the cheek wall, the gums. We liken biofilms to slime on a pier. You know, it just, as the ocean comes up on a pier, it keeps growing this mossy, slimy stuff. And our products are able to penetrate the polysaccharide surface of a biofilm, break it up, and the bacteria that are and oral pathogens that are likely to overgrow and cause disease live within that air-free environment of that slime. So if you take that away and expose the bacteria to oxygen, it's like pulling a fish out of the ocean. It will not survive. It's not being poisoned. It just can't survive because these are, by and large, gram-negative anaerobic bacteria. And so, so they're not going, like an antibiotic, they're not going to develop a resistance like bacteria do to antibiotics. So it's not going to lose its potency in doing that. And so how does that manifest itself? Here's an interesting quiz. We have a sodium fluoride toothpaste. And fluoride is a FDA regulated substance. So all sodium fluoride toothpaste have exactly the same amount of fluoride in them, 1400 ppm or 0.25. Except ours outperforms the two leading brands by threefold and fivefold in remineralization. How could that be if you had the same amount of fluoride in competing different brands of toothpaste? You should get the same performance, right?
Right.
Well, what's happening, we believe, in our product is that our stabilized chlorine dioxide is breaking up the biofilm and killing anaerobes and clearing the pathway so that the sodium fluoride, which is the fluoride ion source, can actually reach the dentin and make more of a difference in terms of remineralization and enamel hardness. So it's not as if we have more fluoride. In fact, we have the same amount or less fluoride than the next guy, but we're more efficacious because we're able to get that that substance next to where it needs to go to work. And that's the principle that is part of our secret sauce, if you like, for our products. So that's a very important thing for people to think about, is not just whether it tastes good or it doesn't burn your mouth or it goes to work when you put it in your mouth as compared to not going to work, but also what does it do? A lot of oral rinses particularly are great at killing bugs. They're general antimicrobials, but they are indiscriminate killers. So there's like 600 bacteria that have been identified in the mouth, and about 18 to 24 are associated with gum disease, right?
Yeah.
Red and the orange complex. So you don't want to kill off the entire oral ecology just to get after some guys that are more likely to overgrow and cause problems. So that's one of the design characteristics, if you like, that we've aimed for, where we don't, we're not significantly injurious to the oral ecology. One of the ways that that's manifest is if you take a general antimicrobial like chlorhexidine, a prescription grade antimicrobial that's often regarded as the gold standard in dentistry. Um, and you use it with a patient who has oral sores or that has osteonecrosis of the jaw or that has Sjögren's syndrome, oral inflammation. It'll help keep those areas very clean and sanitized, but the patient will not heal quickly because it also kills the collagen forming agents, the fibroblasts and the osteoblasts, the fibroblasts for soft tissue and the osteoblasts for hard tissue.
Mm-hmm.
So, and our product is comparable as an antimicrobial, but it doesn't harm fibroblasts and osteoblasts. So you'll see faster healing.
So are you saying this can be used for irrigation, surgery irrigation?
Yes. The largest dental service organization devoted to periodontia is located in Arizona, AZ Perio, and they use that both as a surgical irrigant as well as a post-op.
Really?
Yeah.
Wow. Good to know. Jim,
Yeah.
we have about 60 minutes left. I think 60 seconds left. So I want to just say thank you for coming up my YouTube channel. And I appreciate what you do to support our charity event every year. And I would like to also thank you for your time today that you spend some time and educate dentists and dental hygienists who haven't used your product. And we want to have a chance to introduce your product. So thank you again. Jim, you have 30 seconds. You can say something.
Well, Doctor, I'll start I'll end where I started, which is you guys are the heroes out there. We really appreciate your work in dentistry and particularly your efforts in this podcast and bringing various people who have perspectives and experience to bring to the profession. I looked at your podcast, Dr. Harold Foran and Dr. Zuckerberg,